The Buteyko method was developed by Russian doctor Konstantin Buteyko in 1960s, long time ago, when he realized that many chronic diseases are connected with overbreathing, breathing too much. So when he was a manager of the respiratory laboratory in Novosibirsk, and he had a project funded by the Ministry of Soviet Spaceship Research, like he worked for Cosmos, for our space industry, for first spaceship missions, in fact, like Yuri Gagarin and other people. And he had an excellent opportunity to study breathing parameters of sick people. And he was doing this project for 10 years, and he found that sick people just breathe too much. And so after getting this experimental fact, clinical observation, based on hundreds and hundreds of patients with asthma, heart disease, he developed a technique how to slow down breathing of people. And what he found as well, that the sicker we get, the heavier we breathe. But another related fact is that the more we breathe, the less oxygen we get inside our body, in cells of the human body. So that was a very important conclusion, because people believe often that deep breathing provides us with more oxygen. Like if you start asking people around, 95–97% will tell them if you breathe deeper more, you should get more oxygen. But medical science gives us totally opposite conclusion. Hundreds of studies tell us that sick people breathe more. I have many studies on my website. Like if we look, for example, how much is breathing of heart patients, you see in the diagram immediately that heart patients breathe about 2–2.5 times more air than the medical norm. Instead of breathing 6 liters per minute, which we can see here, you see that heart patients breathe up to 15, 16, 12. So every minute they take much more air inside. Breathing is big, heavy. It's more frequent, and at the same time it's more deep. Like instead of breathing, normal breathing, about 10–12 breaths per minute, like very slow, regular. Heart patients around 20 breaths per minute. So it's fast, but it's also deep, because otherwise you can't get so much air in 1 minute. So we breathe not half of liter of air, which is normal tidal volume, so called, but deeper we take maybe almost up to 1 liter for one breath. So it's the same two parameters change, so we do it more frequently and also deeply. And that reduces oxygenation, which is possible to measure, like oxygen level in the body, using either devices, or we can do a simple breath holding time test. Like I have another graph with several different studies related to breath holding time. So we can see that if we have normal breathing, if you breathe normally right now, like medical norm, you should have about 40 seconds of oxygen in the body. That means you relax, pinch your nose, and see how long you can hold your breath without stress. And after exhalation, you can imagine like it's hard test, because you should first exhale and then pinch the nose and hold breath only till the first stress without pushing yourself. So this number in healthy people, and in fact 100 years ago it was a case, people had up to 40, 45, 50 seconds of oxygen in the body, and modern people, see heart patients for example, heart disease 12 seconds, another study heart disease 16, 13, functional heart disease like severe heart disease, when people hospitalized, 5 seconds of oxygen in the body only. So breathing is very, very heavy, but oxygenation is low. Several studies on asthma, totally the same result. Asthma with symptoms, very short bar, very little oxygen content, 11 seconds. Asthma, just regular asthmatics. Asthmatics without symptoms, you see breath holding time 20 seconds. So this large bar actually corresponds to people with asthma who has much more oxygen, and these are people without symptoms. So it's like completely corresponds to the state of the person. Based on these results, Buteyko found similar results for people with diabetes, COPD, other conditions. He developed a table, Buteyko table of zone of health zones, so-called Buteyko table of health zones, and he just created like different levels, 7 levels of 6 states, like 6 different zones, and 5 zones which corresponds to good health. And depending on the parameters of the person, particularly again breath holding time test, he found also correlation that respiratory parameters correlate with heart rate of people, frequency of breathing, like I mentioned, how frequently we breathe. So generally, the sicker we get, the more frequently we breathe and more deeply we breathe as well.